Music Reset, we're live on Facebook. Good morning, everyone. Good morning, music, to our esteemed guests and to all our media partners. Welcome to Wednesday's Media Forum, April 28. Joining us today is the official spokesperson of the Department of Health, the Undersecretary Maria Rosario Simperheri. Music, good morning po.
Yes, magandang umaga po sa inyo. Welcome to our Wednesday's Media Forum. So ngayong araw po, tayo po ay sinamahan ng ating Minister of Health from the BARM, si Dr. Bashari A. Latif, si Doc Bash, at siya po ang magbibigay ng mga ilang paalala para sa ating mga Muslim brothers and sisters regarding vaccinations. So I'll give the floor to Dr. Bash. Doc Bash.
Good morning sa lahat ng nakikinig at nanonood sa atin. Assalamualaikum warahmatullahi wabarakatuh. Ito pong mga kababayan natin na nag-observe ngayon ng Ramadan, mga Muslim sa ating bansa, ay mayroon silang tanong kung ito po ba pagbabakuna ay may kinalaman po dito sa pagbabaksin ay ma-invalidate o magiging hindi siya katanggap-tanggap kung ang isang tao ay magpabakuna ng vaccinations po dito. So, nagkaroon po tayo ng sinulatan po natin ang Office of the Mufti, ang Islamic Scholar, Executive Director, sa pamamagitan ang galing po dito sa atin sa Ministry kay Mufti Abu Hurairah Udasan. So nagkaroon po ito ng religious guidance or advisory at ang kanyang sinabi ay hindi naman ito nakakasira o na-invalidate niya ang taong nag-observe ng fasting o nag-aayuno during the time of Ramadan kung siya ay magpaturok o magpabaksin sa anumang vaccine. Dahil ito po ay hindi siya nakakasira dahil hindi naman ito energy boost. Kumbaga, hindi siya pangpalakas ng katawan. Ito pong vaccine na ito is about protecting oneself and protecting other people's lives. So, napaka-importante po ito sa atin para at least mabigyan ng ating mga kababayan na mga Muslim na magpabakuna at hindi sila nag-aalangan sa kanilang pag-obserba ng Ramadan or month of Ramadan sa kanilang pag-aayuno na kung baga bigyan sila ng vaccination during the time of Ramadan, masisira po yung kanilang pagpapasting ay hindi po yon. Dahil mayroon na po tayong IFTA na lumabas o Islamic advisory galing sa ating mufti na pinapayagan po naman ito. Na ang isang tao nag-aayuno o nag-observe ng Ramadan ay pwede na po siyang magpabakuna, magpaturok ng bakuna na hindi masisira yung kanyang pag-aayuno. Iyon po ang kautusan o advisory na galing sa ating mufti. Yun po ang nakalagay dito sa Islamic advisory po. Kasi kung matatandaan natin ang pag-observe ng month of Ramadan, pagpapasting, pag-aayuno, ay ito ay abstention from hindi po dapat kumain, hindi dapat uminom, or anumang iba pang nakakasira doon sa Ramadan. Pero dahil marami sa ating mga kababayan na nag-aalangan kung sila ay magpabakuna ba o hindi, baka naman masira yung kanilang pag-observe ng Ramadan at mayroon na pong binigay ang ating mufti na advisory na hindi po ito nakakasira sa taong nag-observe ng Ramadan o nag-aayuno kahit siya ay magpaturok, hindi po na-invalidate o kahit siya ay maturukan ng vaccine. So ito po ay maraming mga kababayan natin ng mga Muslim nag-Ramadan sa ngayon, month of Ramadan, nag-observe, ay sa pamamagitan nito ay talagang nainganyo sila at talagang nagpa-vaccine sila dahil sa guideline po ito. So nagpapasalamat tayo sa kanila dahil tinanggap nila na hindi pala ito nakakasira sa pag-aayuno o pag-observe ng Ramadan.
Maraming salamat po, Doc Bash, for your reminders po, no? Just a quick update lang po, Doc Bash. Kamusta po ang update ng vaccine sa BARM? If you have this data available po.
So far naman, marami na po kaming nabakunahan doon doon sa binigay ng galing sa national sa DOH na bakuna. At ito ay na-distribute po namin sa lahat ng provinces ng BARM kasama ng mga city, Marawi City at Lamitan at iba pang lugar. At umaabot na po kami ng 12,337 na nabakunahan po so far. Mayroon din po tayong allotted na binigay sa mga Hajj. Kasi ang sabi ng Ministry of Hajj at saka Minister of Health ng Saudi Arabia ay bago po sila mag-perform ng kanilang pilgrimage this coming June ay kailangan po nila magpabaksin. So nagpapasalan po tayo, nag-allotted po tayo ng more or less 5,336 vaccine sa mga kababayan natin na mag-Hajj this year. So far, more than 1,000 po ang nag-avail dito. At hanggang ngayon, continuous pa rin yung ating papabakuna sa kanila.
Maraming salamat po, Doc Bash. Doc Bash, just a question here from Red Mendoza of the Manila Times. In the current EUA vaccines, ano po ang halal na bakuna na pwedeng gamitin sa mga kababayan nating mga Muslim?
So far ngayon, ang ating natanggap na vaccine ay yung Sinovac at AstraZeneca. Ito naman ay halal naman ito based sa pag-aaral ng ating mga Islamic scholar at kahit sa ibang bansa ay tinatanggap po naman ito ng walang problema dahil ito po ay hindi siya haram at ito ay halal na mga vaccine yung nasabi kong dalawang brand na vaccine na ginagamit natin ngayon, Sinovac at AstraZeneca, pwede na po itong gamitin at hindi naman ito haram. Siya ay halal.
Salamat po for the clarification, Doc Bash. Next question po from the Manila Times. Papayagan din po ba ang mga Muslim Filipinos natin to go to the Hajj pilgrimage in June? Paano po pagbabalik po sila? Do they need to go into quarantine po pagbalik nila?
Yes, papayagan naman sila. Actually, yung Hajj ay perhaps ito ay mangyayari sa June. Pagdating doon, lahat, kasi hindi pwede sila mag-perform ng Hajj or pilgrims na wala silang vaccine. Naka-vaccinated po ito lahat. Kaya inagahan po natin kasi para at least makuha natin yung first dose as a second dose. So, magpapasalan po tayo dahil sila naman ay inavail nila yung opportunity na mayroon tayong inilaan na bakuna para sa kanila. So pagbalik naman dito at sila ay vaccinated ay diyan naman sa sa airport o diyan sa immigration sila naman ang bahala doon siguro sa ang guidelines na binibigay ng ating gobyerno para sa pagbabalik nila.
Salamat po, Doc Bash. From CNN Philippines, Caroline Bongkin is asking po, Doc Bash, if you have this data available po right now, kung ilan po ang target na mababakunahan sa BARM?
Marami tayong target po ng nababakunahan sa BARM. Actually, we are having about 15,740 ang ating A1 priority of lahat.
Salamat po, Doc Bash. Doc Bash, would you like to add to your response po or can I move on to the next question po?
Ano po yan?
Sige, Doc Bash. Next question po tayo, Doc Bash, from Sheila Crisostomo of the Philippine Star. Ano
Yes.
po ang ginagawa ng BARM Ministry of Health to address the vaccine hesitancy among the Muslims?
Yes, that's a very important question. Yes, of course, there is a resistance. Hindi lang ito dito sa BARM, yung hesitancy. Nangyayari po ito sa ibang lugar. Una-una, kaya gusto namin i-address yung mga fake news. Ang ginagawa po namin, nakikipagtulungan kami sa mga ulama. at sa mga different religious sector para ipaliwanag itong vaccine at saka ano ang nagiging naidudulot nito mabuti sa ating mga kababayan, no? Alhamdulillah, or thanks to Allah, because marami naman ang nalilinawan dito. So yung kanilang pag-alala na ito ang mga side effect ay pinapaliwanag natin sa kanila. Gumagawa tayo ng mass information campaign para ma-address po yung mga ganyang agam-agam. At maraming salamat naman at tinatanggap ng ating mga kababayan doon na marami na pong nainggan yung magpabakuna.
Salamat po, Doc Bash. From Lay Alves of GMA News, hindi po ba makakaapekto ang fasting sa resistensya ng binabakunahan? Since kapag binakunahan po ay nag-a-adjust pa ang katawan at may nakakaranas din ng mild side effects.
Well, of course, may mga kunting nakikitang side effect ng vaccine tulad ng pain doon sa site of vaccination. So ito po ay hindi masyado nakaka-apekto doon sa tao na nag-aayon, no? Nag-observe ng fasting. Sa aming experience, no? Kasi marami na kaming nabakunahan. This month of Ramadan, umaabot po ito ng more or less more than 2,000 plus. At wala namang kaming nakita na nagpabakuna na ito po ay naging dahilan o sanhi ng kanyang pagbaba ng kanyang resistensya. Ito po ay sila po ay nagpapasalamat after the vaccination at hindi po bumababa yung kanilang resistensya. Bagamat sila po ay lalong nabibigyan ng boost or lalong lumalakas dahil sa kanilang isip na nabigyan sila ng tamang bakuna doon sa ito ngayon na ating problema na pandemya.
Salamat po, Doc Bash. From TV5, Greg Gregorio, follow-up daw po on the number of target vaccinees. Ilan po ang A2 and A3 sa BARM po?
So far, ginagather po namin yung mga data sa ating different health facilities at saka mga ating IPHO at kasalukuyan namin kinukuha yung mga priority na nakalagay diyan po sa we are gathering data as of this moment.
Okay po, Doc Bash. Doc Bash, if there are no more questions from our media partners po in relation to your topic, meron po ba kayong reminders po to the public through our media partners?
Yes, thank you very much po. Kami po ay umaapila sa ating mga kababayan, lalo na sa BARM at sa mga kababayan natin mga Muslim, na huwag po kayong mag-alala at sa ibang lugar, diyan din sa Metro Manila at sa ibang lugar ng bansa, na ang pagtuturo po ng vaccine ay hindi po ito nakakasira ng pag-aayon o ang pag-observe ng Ramadan. Bagamat ito ay nakakabigay ng magandang idinudulot sa ating mga katawan sa panahon ng pandemya. Ito po ang isang paraan upang mas awatan natin itong COVID-19. So huwag po kayong nag-alala na ito pong bakuna sa pagtuturok po ay masisira o ma-invalidate o hindi katanggap-tanggap yung inyong pag-ayon during this month of Ramadan dahil mayroon po tayong kautusan na binigay ng ating mukti. Ito po yung kwan. I think bigyan natin ang ating mga kapatid sa media para at least may lakhala at dyan din sa inyo sa DOH para at least mabasa ito ng ating mga kababayan at hindi sila nag-aalangan na baka masira yung kanilang pag-ayon. So ito po again, umapila po kami sa ating mga kababayan na hindi po nakakasira ang sa pag-observe ng Ramadan or pag-aayuno ang pagturo ng bakuna. Maraming salamat po.
Maraming salamat po, Doc Bash. We'll be sharing the advisory po to our media partners after this briefing.
Thank you.
Yusek Cruzet.
Thank you very much po, Doc Bash, for joining us today and giving updates and information to the media and to the public. Maraming salamat po, sir.
Thank you, ma'am.
Maraming salamat po. We'll be moving to the DOH questions po, Yusek Cruzet. I'll start with the question of Caroline from CNN. Gaano karami po ang nasa record ng DOH na na-reinfect ng COVID-19?
Yes, Caroline, no? So, di ba na I think we have mentioned this already in the previous media fora na yung WHO kasi sets the definitions for the type of cases for COVID-19. And up until now, they still have not defined what reinfection is, no, in their official na mga definition. So up to now, meron tayong probable, suspects, and confirmed cases, but the reinfection has not been defined yet. So sa ngayon, wala pa ho tayong official na itatala because of that, but we are monitoring these cases. So every time that a person will come in again and they have another bout, or na-confirm sila uli agad ng RT-PCR, minomonitor natin sila, we treat them again as a COVID patient and we give the appropriate management.
Thank you, ma'am. Next question po. May data po ba gaano kalaki ang binaba ng consultation ng non-COVID patients ngayong April and March?
We have not yet analyzed the data, Caroline. No? So sa ngayon, we do it semi-annually kapag tinitignan natin para kumpleto ang datos natin. Although we have incoming reports, pero hindi pa rin siya kumpleto, no? So titignan natin. But of course, pag tinignan po natin ang sitwasyon because of this increase in the number of cases, especially for March and April, it is expected, no, na bababa talaga yung consultations natin because most of the outpatient units of our hospitals, kinonvert nila into telemedicine, no? So usually the patient would just call or would just do video calls at hindi talaga sila pumupunta doon in person to prevent further transmission. But we will give information as soon as we can get a hold or consolidate all of these reports that are being submitted to us.
Thank you, ma'am. From Christian Yosores, may mga report po on some groups, some led by local officials conducting private COVID-19 vaccinations. Hindi po ba bawal ito? What are the risks of receiving vaccines sa mga hindi official na vaccination site ng government? And what are the benefits of taking the shot from official vaccination sites?
Wala. Unang-una, meron tayong official vaccination sites, no? And these are the accredited vaccination sites. So when we say it's accredited, any vaccination site that will be assigned as official vaccination site, ini-inspect po yan ng DOH because we have standards that we have set kung ano dapat yung mga facility natin for vaccination sites. So kung ito po ay unofficial at may ginagawan sila na bakunahan na hindi po lingid sa kaalaman ng ating ahensya, unang-una, these were not checked for the standards, no, na dapat meron ng isang vaccination site. Pangalawa po, kung hindi po yan sa official vaccination site, ang isang issue dyan, how are we going to track these patients, no, if this was done na hindi po alam ng ating departmento? Because we track the patients, we monitor them for the first 30 days and then onwards also for this 12 months na pagkatapos sila bakunahan. Pangatlo po, alam po natin lahat na ang bakuna ay nanggagaling lang po sa national government at binibigay sa ating mga implementing units. So kung magkakaroon sila ng private vaccination sites, kailangan natin po ma-determine at masigurado saan po galing ang bakuna. Ito po ba ay galing sa national government? Meron po bang local government na nakipag-coordinate sa kanila para magkaroon ng ganitong bakunahan? Kasi kung hindi po, ito pong mga bakunang walang rehistro, ang katulad ng lagi naming sinasabi, hindi po masisiguro ng ating gobyerno na ito ay ligtas at ito po ay makakaprotekta sa kanila against COVID-19.
Thank you, ma'am. From our media partners po in relation to ivermectin and the community PAN3, Christian Nisores and Bons Magsambol are asking related questions. House lawmakers Rodante, Marcoleta, and Mike Defensor will allegedly hold a community PAN3-like initiative on Thursday where they will distribute free ivermectin to people. Natanggap na po ba ng DOH ang report na ito? Can we ask a comment from the department? Kasi it seems like these officials are still pushing for the use of ivermectin despite the facts laid by our experts. Yusek?
Yes, we've heard of this. Pinapaalalahanan lang po natin ang ating mga kababayan. Yesterday, nagpalabas na uli ang ating Living CPG. This is the group of experts comprised of different medical societies where FDA and DOH are part of. Nagpalabas po tayo na yung re-evaluation of these newer evidences for ivermectin, still sinasabi nila insufficient pa rin ang evidence para i-recommend natin ang ivermectin in the treatment for mild to moderate COVID-19 patients. And there is that remark na very low ang quality of evidence. The second, meron ding suggestion against the use of ivermectin for the treatment of patients with severe COVID-19. Again, This is a conditional recommendation from them because of the very low quality of evidence found across the globe. Also, we suggest against the use of ivermectin combined with doxycycline for the treatment of patients with COVID-19. These are all conditional recommendations because of the very low quality of evidences that are existing right now internationally. So talagang maganda yung pinupush natin na clinical trial for ivermectin na gagawin dito sa ating bansa para mas magkaroon tayo ng sufficient and magandang ebidensya if talagang kailangan gamitin o pwedeng gamitin ng ivermectin dito po sa mga nagkakasakit ng COVID-19. So isa lang hong paalala sa ating mga kababayan, ang ivermectin po may nag-apply na ng for CPR or registration sa FDA last March 31. Ito po ngayon ay pinoproseso, ini-evaluate. So sa ngayon po, ang atin pong ang mga nakakagamit no through legal processes no based on regulatory procedures ay yung pong nakakuha ng compassionate special permit, and these are for the different hospitals which have applied and has been approved by FDA. Bukod po dito sa mga ospital na nakakuha ng CSP, ay wala pa hong iba na pwedeng mag-distribute o pwedeng magpamigay nitong gamot na ito dahil nga po hindi po ito rehistrado.
Thank you, ma'am. From Greg and Julia po asking related questions with regard to the pay of health workers. Some groups have said that health workers are not getting their hazard pay in full due to deductions from mandatory quarantine. May we get the DOH response po on this?
Hindi po yan dapat mangyari. So within our protocols and even in a DOH and DBM joint circular that was issued, sinabi po dito na ang mga ating mga healthcare workers who are to undergo quarantine because of being exposed should still receive their benefits. So kailangan po nating pagsabihan ito pong ating mga ospital o di kaya ay ibang mga ahensya na hindi po dapat pong ibigay dapat ang they still need or they still have to receive their hazard pay even when they undergo quarantine. Kasi ito pong quarantine ay kino-consider natin as a paid time for work. And gusto ko lang klaruhin, yun pong ating mga kababayan or healthcare workers, katulad po ng healthcare workers namin sa DOH, pag naka-quarantine po kami, nagtatrabaho pa rin po kami kung wala naman po kaming simptomas. So the work is still there. So kailangan pa rin makareceive ng hazard pay ng ating mga healthcare workers.
Thank you, ma'am. From Patricia Denise Chu, some data scientists and other experts are questioning the daily tally of time-based recoveries and its effect on the active cases' swift decline, suggesting that it's a potentially disruptive change. Can we get the comment on this, Paul?
Yes, So Patricia, we've explained this last night when we issued our social media card o press release regarding this matter. Unang-una po, gusto ko lang ipaalala or ipaalam sa ating mga kababayan that DOH has always been transparent, especially with our numbers. And DOH also was very transparent and recognizes that fact na hindi naman po perpekto ang ating sistema. And as we go along the course of this pandemic, talagang marami pong nagbabago. So napansin po namin, nung tumaas na yung mga kaso from February, March, and this April, yung pong time-based tagging natin every Sunday, parang hindi na siya appropriate. That's why it was decided and it was ordered to us by Secretary Duque, tignan nyo if we can do it already per day para lang mas complete ang picture pag pinapakita natin ang case bulletin sa mga tao. So we have to remember things kapag ini-interpret natin ang datos. Unang-una, yung time-based tagging natin, it's because of the reports may be delayed compared to the symptom onset or compared to the swab test na ginawa nila. Doon natin inuumpisahan. So what we do, inahanap po namin lahat ng tao from the date of their onset or from the date that they were swabbed at bumibilang tayo ng panahon. So alam natin kapag sila ay may simptomas or those symptomatic, 10 days we can consider recovered na kung wala ng simptomas, kung sa datos natin hindi po sila nakalagay dun sa mga deaths at saka yung status po nila ay wala na sila sa ospital. So bumabalik po tayo sa ating local governments at sa regional office namin to verify all of this data. So we have this validation procedure bago po namin ipasok dun sa tag cases. So pag bumalik na, ibabalik po sa atin ng epidemiology and surveillance units namin at itatag namin. So what was this issue wherein people were saying, oh bakit napakalaki naman, active lang siya last week, tapos after 1 week, naging recovered na siya. Babalik tayo doon sa sinabi ko, no? Na hindi po naman agad-agad na pag sinabi natin na nakapag-symptom onset siya ngayon, tapos nakatapos siya, ay nakukuha na namin agad yung datos. Because there is still that lag time where we are able to get them maybe in the middle of the disease process already, or maybe tapos na talaga yung 10 days niya, tsaka namin siya nakukuha at naitatala. Kaya nandun po yung difference talaga between the active and the recovered nung nakita nyo yung I think that was 90 and 70,000. No? Ito yung ginagawang issue. But let me just assure the public, we are transparent. Ito pong ginagawa natin ay base sa datos with the vetting of our local governments, which are our implementing units. Lahat po ng datos namin ay nakatala naman at bukas po ang aming database sa lahat through our situational report. So ito pong nangyaring ito ay para lang po mas maging accurate, no, and complete ang picture for every day that we present the case bulletin. And expectedly, because of this number of cases that are increasing, and we know that 96% or more are mild and asymptomatic, so we expect really na marami po talagang mga recoveries tayo maitatala. Okay?
Thank you, Yusek. From Caroline Bonkin, vaccinations in Latin America has slowed down due to shortage of key ingredients needed to make CoronaVac. Nakalock in na po ba ang expected Sinovac supplies natin, or will this be affected by the shortage?
Well, sa ngayon, Caroline, wala namang abiso sa atin that there would be changes or there would be these issues regarding the Sinovac vaccines. So ngayon, meron tayong parating bukas na 500,000 na Sinovac. And then come May, I think it's first week ng May, makaka-receive pa tayo ng additional doses na committed naman at kasama dun sa pre-procure natin. So sa ngayon, we are not informed yet of any of this kind of delays kung meron man, dahil yung commitment ay naandun pa rin.
Thank you, ma'am. Next question po. Puno daw po ang Syudad Medical sa Zamboanga. May mga nakapila po na pasyente. Ano po ang immediate na response na LGU at national government?
Yes, so we are coordinating with the region doon sa Zamboanga para makita natin kung ano talaga yung detalye nito at makita po natin kung ano yung trends ng kanilang kaso. So kami po ay nakikipag-ugnayan, ngunit kami po ay nagbigay na rin ng paalala sa kanila that they have to be able to encourage at i-enjoy nila ang kanilang mga ospital, that we have this kind of law na sinasabi na lahat ng public hospitals and private hospitals should have that surge capacity. So they need to expand their beds so that they can accommodate more patients.
Ma'am, from Red Mendoza, kamusta na po ang mga discussions with the IATF sub-TWG on data analytics, where the scenarios justify the announcement of the current quarantine restrictions in the country later?
Well, pag tinignan natin, we have different parameters on how we say na or how we determine what community quarantine classification ang ibibigay natin for this month. So ang parameters natin, we have yung ating healthcare utilization, which includes ICU utilization and the other beds nakasama dyan. Kasama sa healthcare utilization natin, tinitignan din natin yung quarantine facilities natin, the utilization of these facilities. And then on the other side, we also look at the average daily attack rate. These are the new cases that we find every day per area per 100,000 population. Tinitignan din natin yung ating 2-week growth rate comparing the number of cases, actual number of cases for this current 2 weeks from the previous 2 weeks. So tinitignan natin kung may growth sila as to positive or negative. And then most importantly, we also look at the gatekeeping indicators. So when we talk about gatekeeping indicators, ito yung capacity naman ng local government to respond based on this specific indicator. So pag tinignan natin, may improvement naman. As we have said previously, yung kaso natin ay yung 7-day moving average natin ay bumaba, although it's still not significant kasi nakikita pa rin natin na yung number of new cases identified per day in specific areas are still high. Mataas pa rin ang ADAR sa mga local governments natin. Yung 2-week growth rate natin, marami ang bumaba na, nagkaroon na sila ng negative. So comparing from the previous 2 weeks and the current 2 weeks, makikita natin may improvement at bumababa ang numero. But as I've said, the current new cases pa rin, pumapasok every day, ay mataas pa rin. When it comes to gatekeeping indicators, nakaka-fulfill ang ating local governments naman. But of course, meron pa rin tayong mga issues, especially with contact tracing. No? So tinitignan natin ngayon, may sinusubukan tayong sistema doon sa together with the National Economic and Development Authority, itong SMS, no, na tracking na gagamitin kung paano. And aside from that, nakatulong ng maigi ang national governments, pati ang MMDA sa local governments, nagdagdag tayo ng maraming contact tracers kasi para mas bumilis. So pag tinignan natin yan, plus yung nakita natin na nakahihinga ng konti, no? Konti ang ICU beds natin because we were able to expand, and yung isolation and ward beds natin medyo na free up din yung iba. That's why our utilization ngayon ay 62% and sa ICU is 71%. When we look at that, meron tayong konting improvement, pero kailangan pa rin na nandun pa rin yung restriction, no? Kailangan ay careful pa rin tayo, cautious pa rin tayo. But looking at the other side of the story, which is the economic, we are losing about 30 billion pesos every day according to the cost-benefit analysis, no, na ginawa ng National Economic and Development Authority. So looking at both sides, health and economics, yun po yung pinag-usapan at yun po ang babalansehin ng ating IATF para makarating tayo dun sa decision. The decision will come in later. We will not preempt that. But I have given you the factors that had been considered.
Thank you, Yusek. From Greg Gregorio po, as well as from Red, related questions po now, Yusek. May we also ask what were the considerations for the issuance of the travel ban on travelers from India, including ROFs, starting April 29 to May 14, even when it is highlighted yesterday that the variant was first detected in India is not a VOC, but rather a variant under investigation.
Yes, Greg, no? Kailangan natin maintindihan, even though this variant is still not of concern, but still under investigation based on WHO's classification, kailangan mag-iingat na tayo. Everybody is seeing what's happening in India right now. The rate of transmission is very, very high. Nakikita natin kung paano, no? And base sa aming pag-aaral at according to our experts, hindi naman talaga yung India variant or this double mutant na sinasabi nila what's causing. No, they also have the UK variant at ito ang mas mataas ang porsyento na meron sila dun sa kanilang bansa. But of course, they are studying this India variant na tawag nila if it's also affecting them. But nevertheless, of course, our country would like to restrict our borders first. Mag-iingat tayo kasi nakikita na natin yung nangyayari sa kanila at ayaw na natin na magkaroon pa ng enabler ang ibang variants na pumasok dito sa ating bansa para makapag-cause pa ng further transmission ng sakit. So this is something that government has to decide on and do so that we can protect public health by restricting our borders temporarily para hindi po tayo magkaroon pa na mas maraming variants kung sakali dito sa ating bansa.
Thank you, ma'am. From Lay Alves, may we ask for a comment from DOH regarding the medicine Pfizer is developing for COVID-19? Is this promising? This early, may initiative na ba ang gobyerno para sa posibleng supply nito once approved?
Yes, Lay. Actually, pag may bago naman, di ba, all of us would always want, no, na makaka-access tayo sa ganito para sa ating mga kababayan. So we are looking into this. Pag lumabas na yung mga trial results, kasi ngayon nasa trial phase 1 pa lang sila, ano, yung iba phase 1B pala, yung isa pa, no? So kailangan natin antayin hanggang makakumpleto sila, and if this will really provide evidence na talagang it's effective, and then by all means, no, the Philippines will access these drugs for our population.
Thank you, ma'am. In relation to what's happening in India, ano po ang mga hakbang ang dapat gawin para maiwasan na exponential increase in cases na nararanasan ng India ngayon? May mga leksyon bang maaaring matutunan dito ang ibang bansa gaya ng Pilipinas?
Of course, no? So lessons are there every day that we battle with this pandemic. The challenge is there, the lessons are there, no? So dapat opportunity yan for every country, especially us here in the Philippines, na pulutin natin yung mga lessons na yan at gamitin natin. And this is what we are seeing right now in India, no? na nakita natin talaga na ang bilis ng pagtaas bigla ng kaso with the existing variants that they have and this apparent variant na double mutant na sinasabi nila, which is still under investigation. But nevertheless, yun pa rin ang lagi nating sinasabi, no? No matter what type of variant there may be, no matter ano yung sinabi ng variant, mas transmissible, mas nakaka-apekto sa katawan ng tao, kailangan lang natin ipatupad kung ano man ang ginagawa na natin ngayon dito sa ating bansa. We have said that over and over again. Whatever type of variants there are, kung ano man ang ginagawang epekto nito sa katawan ng tao o sa populasyon, pareho pa rin ang gagawin natin. We comply with the minimum health standards. We do what we can as share para dito po sa pagsugpo dito sa sakit na ito. And of course, let's get vaccinated. So ito pong mga ginagawa natin sa ngayon, we just intensify so that we will be able to avoid having that kind of experience from that country.
Thank you, Sec. Next question po, ano po ang epekto na nangyayari ngayon sa India sa inaasahang vaccine supply sa Pilipinas? Kasama sa mga inaasahang supply ay magagaling daw po sa India.
Tama yun, and nakapagbigay naman tayo ng abiso na sa ating public at sa inyo, I think in the previous weeks, that because of what's happening in India, they have stopped muna yung kanilang commitments to other country. Hindi lang naman po tayo ang medyo nagkaroon ng ganyang issue, no? So atin pong plano ay nagkaroon ng re-strategize, no? Nag-re-strategize ang vaccine cluster on how we can be able to apportion kung ano po yung mga dadating kasing bakuna supposedly, but because of what's happening in India, nagkaroon po ng redistribution nung dapat na mga bakuna na dadating by May, by June, by July because of this issue. So flexible po ang mga plano natin so that we can be able to adapt and to adjust if ever there are these kind of things that will happen.
Thank you, Sec. Still from Lay, US CDC announced that fully vaccinated individuals in the US, if outdoors and not in a large crowd, no longer need to wear a mask. May paalala po ba ang DOH kaugnay dito, lalo na po sa mga nabakunahan na?
Well, ang US CDC po ay isang reputable institution, no? Pero tayo dito sa Pilipinas, susunod pa rin tayo ayon dun sa ating mga ebidensya at ayon din po sa mga rekomendasyon ng ating eksperto. Unang-una, alam po natin lahat, and even international evidence would dictate or say, or state that our vaccines right now that are available, they cannot block transmission fully. So ibig sabihin, kapag ikaw ay nabakunahan, wala ka pa ring 100% na kasiguruhan na hindi ka na magkakasakit at hindi ka na rin makapanghahawa kung sakali. So dapat, with that being said, maingat pa rin tayo kahit nabakunahan na tayo. So kahit nabakunahan na tayo, kailangan paglalabas tayo, we still comply with the minimum health protocols. At iyan po ay isang bagay na kailangan nating gawing lahat para makaiwas tayo sa posibleng ma-infection uli dito sa sakit na ito.
Thank you, Sec, for your reminders. Ma'am, I know you have an engagement at 10 a.m. po, so I'll go through the questions that were sent in the chat very quickly po. From Sheila Crisostomo, may mga COVID cases na nag-positive pa din sa swab even after completing the quarantine period. Does it mean po ba na mas matagal magstay sa body ang new variants?
Wala pong ganyang ebidensya, no, Sheila, no evidence at all na nagsasabi ng mas matagal nagsistay sa body ang variants. Pero ang alam kasi natin, and it has been proven already by evidence, even from the start of this pandemic, that RT-PCR is a very sensitive test, no? So kahit na nga, sabi nila, kahit na 8 weeks na, you can still stay positive, no, dito sa RT-PCR na to. Pero kailangan natin tignan and correlate this clinically. Kung ang pasyente ay magaling na, wala na siyang simptomas, nakatapos na siya ng 14 na araw o 10 araw, kahit na positibo pa siya, hindi natin siya pwede i-consider na may sakit pa siya at nakapanghahawa. Kaya nga po nagkaroon ng guidelines ang ating gobyerno through DOH. Before, if you will remember, we do not require repeat testing because this becomes a reason or a factor why patients are staying longer in hospitals kasi hanggang positive sila ay silang pauwiin eh. Or even individuals not being able to go back to work kasi nakapag-quarantine or nakapag-isolate na natapos, wala ng simptomas, pero pag nirequirean mo ng test at positive pa rin, hindi pa rin sila pinapapasok sa trabaho. That's why DOH made that position as recommended by our experts, no repeat testing because RT-PCR is very sensitive that even the remnants of the virus can still be detected until the 8th week, no, from the time that they got sick.
Thank you, ma'am. From Julia Ornedo of GMA, are there guidelines in place for Filipinos in India who want to return to the Philippines? What will be the quarantine protocol for them?
Sa ngayon, parang napagdesisyonan no that even our fellow Filipinos hindi muna natin papapasukin for this temporary period na sinasabing 14 na araw o 2 linggo. This is just so that we can be able to ensure na mag-guard natin yung borders natin. So lahat naman po iyan ay itatransmit as advisory, especially for our fellow Filipinos who would wish to go home coming from this country.
Thank you, ma'am. From Sheila Crisostomo, ilan na daw po ang na-hire ng DOH for deployment sa hospitals? Ilan pa ang kailangan i-hire?
Nung nag-umpisa tayo ng ating pandemya, this pandemic, we had a plan for the health human resources. We were able to forecast and estimate how much healthcare workers we will be needing so that we can fill up the gaps in our hospitals and other COVID facilities that we use. And ang total po ng ating kailangan noon was 10,568. And this was approved by the DBM for funding. So sa ngayon po, ang amin pong na-hire ay total 8,570 pa lang. Meron pa ho tayong gap and the challenge still would be the takers, no? Yung pong mga gustong sumali at magtrabaho dito sa atin sa gobyerno. So tuloy-tuloy po ang pag-hire natin. Aside from this, our hospitals were given funds so that they can hire also from their units or from their facilities ng mga healthcare workers. So parallel po natin yan ginagawa para bumilis po ang ating pag-hire ng ating mga workers.
Thank you, ma'am. Ma'am, yung question po ni Greg with regard to SRA po. The DOH reaction po on a tweet of a staff nurse who only received 681.82 pesos as his SRA from September 15 to December 19. How does the DOH calculate the SRA, and how does the agency respond to calls to reconsider calculations of such, especially now that health workers are once again facing a surge of cases?
Yes, kailangan natin makuha lahat ng detalye, Greg. No, I cannot answer you right now because there are a lot of things that has to be considered. Gusto namin malaman paano kinompute ng facility. Kapag ba nag-quarantine, tinanggalan nila? Kapag meron bang mga leave yung tao, natanggal din ba? Maraming bagay no, na maaari maka-apekto. So kailangan lang namin makuha yung detalye so that we can explain it properly. But definitely, as I've said a while ago, if a healthcare worker goes into quarantine, both for public and private, nakalagay po yan sa ating guidelines na kailangan binabayaran pa rin po sila.
Yusek, I believe those are all the questions we can accommodate for today. Ma'am, may reminders po ba kayo before we end today's briefing?
Yes, no? So unang-una gusto ho natin magpasalamat kay Doc Bash from BARM sa pagsali po niya dito sa atin ngayon, dito sa Media Forum, to give that reminders, no? Especially to our Muslim brothers and sisters, na ang bakuna po ay meron naman po, no, it's acceptable according to Doc Bash para po dun sa ating sa religion. So hindi po dapat mag-agam-agam at tayo po ay magpabakuna because this will protect you and your family. Gusto lang ho naming ulitin yung atin pong araw-araw na sinasabi, no, let's be careful, let's comply with the minimum health protocols. Katulad po ng sinabi kanina, we have restricted our borders starting tomorrow dun po sa mga manggagaling po sa India. And katulad ng tanong kanina, of course, ayaw po natin na matulad dun sa bansang iyon kung paano po nangyayari sa kanila ang pagtaas ng mga kaso. So sana po tulong-tulong po tayo lahat para maibsan ang sitwasyon, tuloy-tuloy bumaba ang kaso at magkaroon ng decongestion sa ating mga ospital. So yun din po, pangatlong paalala ay kung kayo po ay eligible na magpabakuna, please have yourself vaccinated. Ito pong bakuna, aside from our minimum public health standards, ay ang pinaka-epektibo, no? Para po magkaroon tayo ng protection at magkaroon po tayo ng new normal na tinatawag natin in the coming months. So thank you very much and we will see all of you on Friday. Thank you, Nick.
Thank you, ma'am, and all your media partners.